Cardiovascular diseases or heart diseases are the number one cause of death for men and women worldwide, according to the statistics gathered by the World Heart Federation. It is the leading cause of fatality among women all around the world. More often than not, heart diseases are thought to be more of a problem for women. But doctors say that older women stand a huge risk of getting diagnosed with cardiac disorders. Knowing about a disease is the first step of preventing it. So today we will discuss all heart disease in women in our video. Most common types. Abnormalities of the heart and the blood vessels are collectively called cardiovascular diseases. The common ailments seen in women which are related to the heart are coronary artery disease. This includes the blockages in the blood vessels around the heart. Peripheral artery disease. This denotes the blockages in the blood vessels in the arm or the legs. Arrhythmia. This means there are problems with your heart's rhythmic beating. Valvular heart disease. This includes problem with your heart's muscle or valves. Congestive heart failure. This means there is a problem with the pumping or relaxation functions of the heart muscles. Causes for heart diseases in women. Heart disease might be congenital, present from birth, or they might have been acquired during your lifetime. Knowing the roots of these diseases can make you well prepared to combat them. So here are some of the common causes of cardiac diseases in women. Diabetes. Women with diabetes are more likely to develop heart diseases because diabetes can interestingly change the way you feel pain, so you're at a greater risk of having a silent heart attack without symptoms. Mental stress and depression. Stress and depression affect women's hearts more than those of men. Depression makes it difficult to maintain a healthy lifestyle and follow recommended treatment. Smoking. Smoking is a greater risk factor for heart diseases in women than it is in men. Inactivity. A lack of physical activity is a major risk factor for heart disease. Menopause. Low levels of estrogen after menopause pose a significant risk of developing diseases in the smaller blood vessels. Inflammatory diseases. Rheumatoid arthritis, lupus, and others can increase the risk of heart disease in both men and women. Symptoms to watch out for. The most common heart attack symptoms in women are the same as they are in men. Some type of chest pain, pressure, or discomfort that lasts more than a few minutes or comes and goes. But chest pain is not always severe or even the most noticeable symptom, particularly in women. And it is possible to have a heart attack without chest pain. Other common symptoms of heart diseases are pain in your neck, jaw, or throat, pain in your upper abdomen, upper back pain, nausea, fatigue, shortness of breath. How is a heart disease diagnosed? Depending on the type of cardiac disease, your doctor can prescribe you some tests. First of all, you'll need to give your physician your family history. Then they will ask about your symptoms, when they started, and how severe are they. They'll also ask you about your lifestyle, such as if you smoke or exercise. Blood tests can help a doctor figure out your risk of heart diseases. The most common is a lipid profile, which measures cholesterol and triglycerides. Cholesterol in your arteries can cause coronary artery disease, which is treated by a bypass surgery. Some other tests include electrocardiogram. It is to measure the electrical activity in the heart. This helps a doctor look at issues with your heart's rhythm as well as evidences of heart attacks. Echocardiogram. This is an ultrasound of the heart and looks at your heart structure, function, and the performance of the heart valves. Angiogram. This is used to observe X-ray images of your major blood vessels. It can predict whether you have blockages that may be limiting blood flow to your heart. Apart from these, ultrasound of carotid arteries can also be performed in your neck to look for stroke risks. Treatment. In general, treatment for heart diseases usually includes lifestyle changes. These include eating a low-fat and a low-sodium diet, getting at least 30 minutes of moderate exercise on most days of the week, quitting smoking, and limiting alcohol intake. Medications. If lifestyle changes alone aren't enough, your doctor may prescribe medications to control your heart disease. The type of medications will depend on the type of heart disease. Medical procedures or surgery. If medications aren't enough, your doctor may recommend specific procedures or surgeries. The type of procedures will depend on the type of heart disease and the extent of the damage to your heart. Preventive measures. Try these heart-healthy strategies to prevent any cardiac diseases. Quit smoking. Try to avoid exposure to secondhand smoke, which can also damage blood vessels. Exercise regularly. In general, everybody should do moderate exercise, such as walking at a brisk pace on most days of the week. Maintain a healthy weight. Ask your doctor what weight is best for you. If you're overweight, losing even a few pounds can lower blood pressure and reduce the risk of diabetes. Eating a healthy diet. Opt for whole grains, a variety of fruits and vegetables, low-fat or fat-free dairy products, and lean meats. Manage your stress. Stress can cause your arteries to tighten, which can increase the risk of heart diseases, particularly coronary microvascular disease. Heart diseases can be hard to deal with, but many people come out victorious, and so can you. Our wishes are with you for your well-being. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos and subscribe to our channel. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe, stay healthy, and let your voice be heard.